The examples they use are hospital, outpatient settings, and prison.
Who does that?
But, I mean, how is prison a better example than a strip club, if we're being real here?
When things are wrong, I'll be by your side. Living a lie, even when you want to cry.
Lies.
Welcome back to the Naked Apple. In case you missed the last episode, go back and watch it. But here's a brief summary of the last episode. Yep. That's it.
That is a perfect summary of the last episode.
That's it. In short.
You are officially handicapped.
Yep.
Yeah.
There we go.
Yeah.
You're all caught up.
Seriously, though, you'll want to go back to the first one. This is much like if you've been listening to our stuff, it's like the
Why Marxism?
Marxism. Yep. Why Marxism?
Why Marxism?
Oh, that's why Marxism. It's a two-part thing linked together. First episode, we mostly me, stated some grievances, and now I'm going to put data to explain why my grievances are the way they are. And then Mike donated a couple of good news stories.
I donated a brief outline of a new Change My Mind episode that should be aired eventually. That is, China is the greatest threat to the free world. Change my mind.
Yeah, he teased that. That's coming probably at the end of this, I guess.
Most likely.
Yeah. So gonna dig right into it. We left off last time mainly talking about mental health because of a boy that committed suicide on his Zoom call with school. So I remember I have this, call it a blessing or a curse, ability to remember things that at the time seem whatever. But then things happen and occur, and I remember that thing happening, and I find that thing no matter what the algorithms do to try to hide it. For example, we're diving into why mental health is a bigger problem right now than the coronavirus. Back in January, I remembered a report being put out. Two reports, actually. I'm only covering one, but real quickly, the other one I just remembered is I believe it was in December, the WHO, the WHO, I think, put out a thing.
Who done it?
Who's useless? Who?
That's terrible and funny.
They put out a study of how video games can be detrimental to. This actually ties in really well with this. Video games are detrimental to children and teenagers' mental growth, whatever, something like that. Basically saying video games are bad and it hurts their brains. And then a few months later, the Rona shutdown starts. The China virus. It's the China virus. Block us, whatever. Because
we call it the China virus because it comes from China.
Just like the West Nile virus came from
the
west
West
of the
Nile?
Nile. Interesting. The Spanish flu, España. Anyway, a few months later, after telling you video games are bad for your kids, and everyone's starting to start the beginning of 2 weeks to flatten the curve, the WHO puts out a study why video games can be great stimulus for your children's minds.
Wait. What?
Yeah. That, if I find the links while putting these up, I will put them up. If not, that can be your homework to find out if I was telling the truth or not.
That's good homework.
I know that I am telling the truth. I will sign an affidavit. Anyway, the link that I do have is this coming from, I don't know who, WBUR, sounds like some radio something or other. WBUR.
112 at your news station. That
Social
could have been a news anchor.
Yeah. Social media use linked to anxiety, depression among teens, new study finds. January 9th, 2020. This is pre-lockdown. And the study goes on and on about how all these things give false stimulus to the mind and things like that, and it's not very healthy for kids to stare at screens all day. Now, if you're already ahead of me, you understand already why that is annoying, because kids now can't go to school, and their school is virtual, so they have to stare at the screen, and they're stuck inside the house, so they can't really go out and socialize. They have to socialize with their friends through social media, video games, pick any kind of screen the kids are watching it. But it's not detrimental to their minds. It's better to have a Zoom Thanksgiving than a COVID Christmas.
So they're going to give us both?
Yeah. And then I remembered also, somewhat early on, this is coming from CNN. See if I have this in the right order. Yes, I do. CNN reported that child abuse reports are down during the pandemic. Oh, that's great. Except experts are a little worried about that because child abuse is mostly caught in schools.
Oh. So
but the TL, I'm trying to go through these fast because
the TLDL.
the TLDL, TLDR. I'm trying to go through these fast because I have about 1,000 links to go through.
Seriously, there are so many.
But in this, they're talking that their main concern is something about criminals not reporting crime. Yeah. So apparently, people that abuse children aren't going to turn themselves in for abusing children.
Interesting.
So your child can't go to school. They have to be locked at home. And parents can't go to work. They have to be stuck at home. So now a child that is maybe abused an hour a day
is abused 24 hours a day.
Is now abused 24 hours a day because the abuser, mom or dad or grandma or grandpa or aunt or uncle, whoever their guardians are,
legal guardian, X, Y, or Z,
or even someone staying at the house, or even an older sibling, whoever it is, they are also stuck at the house with a child that can't go to school. And at this time, this was CNN reported this in May. At this time, there wasn't really the online schooling really happening. It was schools were just shutting down, trying to figure out how to actually do online schooling. If only there'd been online schooling before that. Oh wait, there was, but we wouldn't. Anyway, so kids don't really have an out of sitting in front of a camera, at least for half of a school day or however long it is. They're stuck at home with nothing to do, with people who can't go to work and have nothing to do. And they can't go to the store. They can't go to the zoo. They can't go to Disney World. They can't go anywhere. They can't go to a restaurant.
They can't go to the park because it's been welded shut.
Or it's been taped off and patrolled by police. So they're stuck at home. And
but
you
that's
can only
if they live in a Jewish community in New York.
They're stuck at home, and you can only play Uno so many times before you really start hating everyone in your family.
And then you play Monopoly.
And then you play Monopoly because that's so much better. But yeah, so the concern here is that child abuse is actually extremely high because of this. But they have no way to record that, no way to report that, because there's nobody to report or catch the abuse.
I hate it.
I hate it.
I hate it.
And then Why is this one here? That one shouldn't be there. I'm on the wrong page. That's why. I found it.
Medical news? That one? Which one are you on?
Depression. So,
Medical news.
yeah. Whatever. Go away. So, another concern early on. This study was done in May. U.S. cases of depression have tripled during the COVID-19 pandemic.
Oh,
Yeah,
dude.
tripled.
Those numbers, though.
Yeah, the
Ouch.
1 in 4 U.S. adults now report experiencing symptoms of depression. Again, this was done in May, May, something like that. So early on in the depression, April or May. Hey, there we go. I can go like that. Hey, now I can see the screen if I do that.
There you go.
That's more comfy. I can get.
That would be why we bought you the microphone arm, so you could move it
So I
around
can
and
actually-
situate it so
I
that
can actually see what I'm doing.
you can see things
shift
and
things around.
we can still hear you.
How about that?
Yeah,
Ain't technology something?
it is
Now,
amazing.
if only there's a way to broadcast what we're talking about across some sort of interconnected computer system.
Yeah, we could call it the interwebs.
I like that. I like that. I like that.
I'm so glad I thought it up just now.
Yeah. Hey, maybe we can get climate alarmists to help us push that into.
We
public
could, I think Al Gore was talking about wanting to be a part of something like that once.
Yeah.
I think he'd probably help us out.
He probably even invented it, for all I know.
He might have. Who knows?
Probably. So we're gonna be doing things like that because we're mad. So apologies, but
They might be trying to screw me.
Well, of course they're trying to screw you.
of course, of course.
Speaking of environmentalists on the internet,
Move that to there so I can see it better. There. Okay, now I got 3 screens in my field of view.
there you go.
So before the pandemic, 8.5% of U.S. adults. Again, this is adults. This study just did adults. From my quick searchings over the weekend, I could not find a study about children. And from what I can tell, there's not really a whole lot of info on child depression, teenage depression, at least study-wise. So 8.5% of U.S. adults reported being depressed. That is now 27.8%. And again, this was April, May.
BU study.
It's the first large-scale investigation into America's mental health in response to COVID-19.
April 13th.
April 13th.
Between March 31st and April 13th.
Yeah. So just 2 weeks. Just 2 weeks to do a study. And they found that number. And, that might be, whatever. That's at the beginning. People were worried and upset and
Yeah, so it's got to be better by now,
So
right?
Everyone's kind of gotten used to it. Restrictions have been lifted-ish.
Yeah,
across the
life's
country.
going back to normal, and
You only lost-
people are able to work their jobs and open their bars and
Except they
do
can't.
these things that
Except
were
they
leading to
can't.
what?
Yeah,
No?
Nope.
No?
Nope.
Oh,
Except no.
oh.
But the good news is it's not just the U.S. that's suffering from this. You might have thought this is just a U.S. problem. No,
Yay!
COVID is a global problem. Australia reports that Zoloft, an antidepressant drug, is now in the top 10 most commonly prescribed drugs in Australia. That couldn't have anything to do with depression, except it has everything to do with depression. That's why Zoloft is that's the primary reason why Zoloft is prescribed to people. And
I mean,
this-
I could think of other reasons
and
why.
Australia writes their dates wrong, but it's
30, 11, 20.
so November 30th,
Oh, so November 30th.
2020.
You say we don't have
so,
30 months in a year. What is this, Bolsheviks?
So this isn't a study. It's just noting that these drugs have been moved a lot more within the state. So of these drugs, the top on the list are heart-related drugs, and then diabetes and or some sort of weight-related something drug. And Zoloft is now in that list of top 10.
Hydroxycut. That's the one that's directly above.
This data was
Hydroxycut.
collected between July and June. So halfway through the pandemic shutdowns, and people are rushing to the doctor to get antidepressant drugs because they apparently have lost all hope after losing their job, losing their school, losing their income.
Because if something is wrong in our lives, the immediate answer is a pill.
A pill. This was in May, so I found out something while studying all this, besides what I'm pointing out that I found out. Market Watch is actually a great source to find out what's going on in the world.
Oh, really?
Besides money. Because Market Watch points out, and there's something else Market Watch pointed out that I don't have on here, but
They also have 100 out of 100 on NewsGuard
well, good for them.
for funsies.
Yeah, so you can trust
I
them.
only have that for like another week
But
because I'm not willing to pay for it.
fair.
Thought
Market
so.
Watch reported on May 26th, anti-anxiety medication prescriptions have spiked 34% during the coronavirus pandemic. So people are super anxious, and usually linked with anxiety is a depression. That's not pointed out in this, I don't think. But no, Express Scripts noted this sharp U-turn from the 12.1% decline in the use of anti-anxiety pills. So that's something they point out. It was on the decline before. People were getting less anxious. People were getting less depressed before coronavirus. Now, what was happening in the market before the coronavirus hit?
No, I mean, when the economy was at an all-time high, our nation was basically the best it's ever been.
Unemployment was
was at an all-time low.
So people actually had money, had a job, so they had less to worry about in their lives.
It's almost like real-time watching what government intervention does to actual people's lives.
Now, there was one thing I found on Market Watch that I don't have because I didn't want to pay $3,500 for it. It's
understandable.
It's a report on which antidepressant drugs to watch this year.
I bet Pfizer's is up there.
Zoloft is probably one of them.
And
all that
I would
stuff.
say probably benzodiazepine.
Right. But
Just because that's the only one that I actually know the name of.
the reason why that made me mad, it was if you pay us $3,500, we will show you how to make money off of people getting depressed.
Yeah, that's a little morbid.
I mean, it probably doesn't help that I was already in that negative mindset to begin with. But it's hard to not look at it that way now.
Well, I mean, the drug industry as a whole I have issues with, but, you know.
Agreed. They're great, but they're also not great. Mm-hmm. But, you know, that's Market Watch. So what about the Hill? Americans are taking more anti-anxiety medication and antidepressants during coronavirus pandemic report. A new study documents quick spikes in prescription medication during the COVID-19 pandemic. Interesting. And in this, it's a lot of the same stuff. Initially reported in CNN, the analysis conducted by Express Scripts saw a 21% increase in the number of prescriptions for antidepressants, anti-anxiety, and anti-insomnia. Oh, people can't sleep now.
That one was between February and March.
Yeah.
For a month.
And I saw this one, and that made me start looking at insomnia stuff. Because, again, all of these things are all these studies, they stopped doing these studies after April and May. Studies stop, except for the Australia one, but that's Australia. The American studies stop around April and May. Around April and May.
Does Australia still have it figured out?
I don't know. We'll have to check in with
Australia gets it.
I have to check in with our friend there. But around April, May, it went from the stop panicking, there's no need to panic from the Democrat liberal side to this is Donald Trump's fault. He's mishandling things. I'm not saying there's conspiracy there, but
this is why I don't understand the other side. Like, I can get their political point of view if they try to explain an actual thing that they want in policy and things like that. I can understand where they're coming from, and I can argue it. What I don't get is how you can literally live through this year watching as these people get on the news and land blast the president for shutting things down too early, for being xenophobic, for overreacting,
right.
And then literally in the span of a week, flipping the script. He didn't do enough. He didn't react early enough. How do you watch that?
The best is he's Hitler. He's literally Hitler. He's trying to be a dictator. As Cuomo and Newsom and all these other dipstick mayors and stuff are forcing restaurants to close.
And as he literally says, I'm not going to overreach and command anything. I will help if I am asked to help. That was literally what he said.
Yeah,
and they called him a dictator.
Yeah, he said...
The most anti-dictatorial stance you could possibly take in this situation, and he was called a fascist and a dictator.
Yeah, because he followed the Constitution and recognized this is a state-by-state thing. You go back and watch our Liars thing. We talk all about this in the Liars.
And it just blows my mind that you can live through this, and you can see this was mainstream media posting these things. These talks by Pelosi and Biden and all these other people calling Trump to the mat for responding too heavily, for overreacting to the virus, and then literally in the span of a week, it was a week, and then there was instantly we have to lock everything down, and it's Trump's fault, and he didn't do enough.
Yeah.
Like, how do you...
And the week before that, you can go and see them. Come to Chinatown. Come to Chinatown. Come into business. Yeah. Little peeved. The New York Post. You can't trust them because Twitter says that they're unreliable.
Well, that's just because they posted the Biden story before anybody was ready to admit that there was something wrong, and before they could remove Biden from being president because he wasn't president yet.
And then the news on election night saying now is a good time to ask Joe Biden about Hunter Biden's dealings. Now is a good time to ask.
I feel like
everyone's voted.
I feel like this is the conversation that Twitter and the New York Post had a few months ago.
Honor, I object!
And why is that, Mr. Reed?
Because it's devastating to my case!
Overruled.
Good call!
Good call! New York Post. More Americans turning to anxiety medication amid coronavirus pandemic. May 25th, 2020 is when this was put up. The study was probably the same one I've been looking at before, but they say all the same stuff. Meanwhile, prescriptions for antidepressants rose 9.2% from 27.2 million to 29.7 million from March 2019 to March 2020. 2.5 million increase in antidepressant prescriptions in 1 year after it was going down the year before. Yeah. Dr. James Potash, Director of Psychiatry and Behavior Sciences at Johns Hopkins Medicine. Let's see. They tried to delete a study that showed that masks don't work. But, disregard that. Noted that the most popular anti-anxiety drugs were
benzodiazepine.
They are powerful, and they are powerfully attractive in that they work instantly.
That's how I know it. It's, well, I mean, I don't It's the main thing for Valium, Xanax, Ativan, and Klonopin. I didn't know that originally, but I had heard the word benzodiazepine before, so there.
But Potash cautioned that although the drugs are effective for short-term treatment, users can develop a tolerance to their effects in as little as
2 weeks. What?
2 weeks to flatten the curve.
Sheesh.
So you lost your job after we flattened the curve for 2 weeks. They weren't talking about flattening the COVID curve. They were talking about flattening the economic curve.
It would have been perfect if all we had the lockdowns for was 2 weeks, because then they could get the prescription, make it through the 2 weeks, and go back to work and be happy again.
They wouldn't even need the prescription.
And now it's you've effed everything up.
It wasn't 2 weeks to flatten the curve. It was 2 weeks to convince you that they have control.
That's what it was.
That's what it was. Convince me otherwise. That can lead people to increase their intake, making it harder for them to stop gobbling down the pills, and leading to potentially dangerous withdrawal symptoms when they finally do. What kind of
Pop 'em from a
withdrawal
Pez
symptoms
dispenser.
could that be? Could it be deeper depression? Could it be suicide?
Could be.
Finally,
Finally.
for this section.
Oh.
But wait, there's more.
You've got like 12 other links here.
So insomnia was mentioned on the one, and so since I wasn't finding things beyond that other than Market Watch saying, hey, look at these drugs that are on the rise, maybe you should invest in them because people are sad and don't know what to do with their lives, so make money off of them. Survey reveals...
I mean, that's one way to deal with your depression.
Yeah.
Just make money off of other people's depressions.
It's a vicious cycle.
Misery loves company.
This is from...
And who's more miserable than somebody that preys on other people's
This is from
shortcomings?
PRNewsWire.com. I don't know who they are, whatever. But this was November 23rd, 2020.
Just a couple weeks ago.
That's when this was published. Survey reveals prescription use among insomnia patients tied to comorbidities, severity, HCP engagement. So I looked for insomnia cases in the United States, and this is what I found, because the algorithms don't tie insomnia to COVID and depression stuff, even though in this they talk about how they noticed an increase in insomnia medication, like we showed on Market Watch, and so they put out a survey for people that were receiving these prescriptions. And people were responding said they had major sleep disorders. Why did they have sleep disorders? Because they also, many of them reported they had anxiety, and most of them reported they also had depression. So insomnia is on the rise, and most of those insomnia people are depressed.
Also, anti-anxiety, antidepressants, and pain relievers.
Yep, and they had medications to go with that, and the medication caused insomnia, and the insomnia caused more depression, so they got something for the insomnia, and that also caused depression.
I took a pill that made it so I couldn't sleep, so I took a pill to sleep that made it so that I needed a pill that made it so I couldn't sleep.
So how many... So all you self-righteous medical people out there that think, just wear a mask, it'll be fine. We did that for 2 weeks. We gave you 2 weeks because we didn't want to overwhelm the hospitals. It was a fair argument. So we don't know what this virus is exactly. We don't know exactly what's going to happen with it. Give us 2 weeks to kind of hold it off while we figure out what it is, and don't overwhelm the hospitals. Fair enough. We'll give you 2 weeks. 8 months later, this is an evolving disease, and you can't pay attention to Donald Trump early on when he said we can't let the cure become worse than the disease. Even though
we shouldn't let the cure become worse than the disease. That's stupid. Just saying.
Yeah. So for those of you that
Well, of course they're trying to screw you.
For those of you that still think it's a great idea to keep everyone shuttered inside because you sit comfortably in an essential job where the government is basically paying you to continue working while everyone else in the non-essential jobs has to wonder where their next loaf of bread is coming from for not only themselves, but their wife and their kids, screw you. Because people are dying from other things, and death rate from that is going to be, the death totals from that is going to be way higher than anything from coronavirus. CDC updated their stuff, 99.8% survivability. Why are we still locked down?
Control.
It's all about control. Mm-hmm. Control. I think we need a vitamin break. You got a vitamin break?
Control Alt Delete.
Control Alt Delete. Yeah, the delete button's missing.
The delete button's missing. Well, yeah, actually, I think we can do a little vitamin B break.
Vitamin B break.
Here we go. We didn't do that at the beginning, so let's do that right now. Here we go. And welcome to your vitamin B update. So, on the lines of coronavirus, there is help at last. House Relief Bill will provide free going out of business signs to small business owners. And that is a welcome relief indeed, as so many people are just fed up with having to try to meet their ridiculous criteria. In other news, entertainment news, movie studio accidentally releases uplifting inspirational movie in this time of trouble. I'm not sure which movie studio it was, but the name of the movie is called The Last Champion.
The Last Champion.
Which I could make an inappropriate joke about, but I'm not going to. I had a friend once. He had a nickname for a thing that he did that was the champion. It was awkward for everyone. So, and now we have one last piece of information about the president before he finally removes himself from the office. Trump one-ups Obama, Bush, and Clinton by publicly taking 21 doses of vaccine at once, just to prove that he made it better.
Nice.
And that has been your vitamin B. That one's good. Gotta love the vitamin B updates.
Gosh, dang it. Stop it. Moving on. So another thing being pushed through the news is hospitals are overfilled. They're stuffed.
Well, we touched on that a little bit when we were talking about the Utah. There's 5.
Yes.
5 of them.
5 of them.
It's kind of hard not to be overrun when you cram the entire population of the state into 10% of the hospitals.
Yeah. Yeah. And it's not just Utah. It's not just Utah. Okay, that's what that was. Gosh dang it. All right. So I was trying really hard to put this in a easier to read data sheet, but I don't do Excel. Well, I do Excel. I don't do Excel well. I don't excel at Excel.
I was about to say that. There are many things you excel at. Excel is not one of them.
Excel is not one of them. I can, if I have time to actually look for what I'm looking for, and I also didn't have actual Excel on my computer. And so I was using whatever I had, and it didn't quite have all the buttons where I wanted them to be. But anyways,
you could have forwarded it to me. I could have done it.
Every 3 or 4 days, the HHS collects data from every hospital across the country on COVID stuff, COVID-related stuff. And we're told that, across the country, hospitals are filling up. They're running out of room at hospitals, running out of room. The way that they talk about it, when I was going into this, I'm thinking, okay, the hospitals are like 90% filled. at least, if they're talking the way that they're talking about it.
Even that wouldn't be unusual in California.
There's that. And that's part of what I have. So this state thing, the CW, is countrywide for this. I pulled this is data straight from HHS, and the links will be in the description.
All of the links.
I'm putting
many links.
I'm hoping I can put all the links in both things, so then I don't have to try to split them, this and that. But anyway,
you might just have to link to a document, like a Google Doc that has the list of all of the links, because there's like 100 links in here.
I have to see how many characters, if I surpass the character count for description. Probably will.
Yeah.
That's a thing. Anyways, so it shows... it won't let me pull that.
Here, hold on a second. So it's not letting you do a bunch of stuff because it is not signed in.
Yeah.
Not activated.
Activate.
Sign in. Where'd your mouse go? Mouse? There you are.
Mouse. Again, our show prep is on point. This.
Good heavens, typing sideways sucks.
Little personal. Encroaching. Password. Yeah, I was digging through this data. I was digging through this data for a good chunk of the weekend.
Glad you pulled that down off of what was getting copied.
Yeah, I'm smart like that. I may not be intelligent, but I am smart. That's how that works, right? Crows. Cool. All right.
Should have full access now.
Thank you, IT support.
You're welcome.
So,
like I said, I'm not the talent. I'm the money.
so what's missing here with the pound signs? That's the collection date. Which
yes.
was November.
So you should be able to stretch that out, and so it's pound signed like that because the column is too small. So you have to make it wider.
Why won't it let me make it wider?
That is a good question. Right click it. Because you have to restart.
Oh my goodness.
Sorry.
All right, let's try this again. By the power of Grayskull.
Next.
Yeah.
No.
You collect it anyways.
Yeah, done.
No.
There you go. Now it should give you... Yeah, there you go. Ha-ha!
There we go. There.
It's almost like I know what I'm doing sometimes.
So the most recent collection date, here we go, November 9th is the most recent collection date. Nope. I lied.
I was going to say, you got...
That was down here. 12/3, December 3rd, 2020 was the most recent collection date. And up at the top here, the numbers from left to right is the staffed...
Adult ICU beds.
So the beds that have staff to cover the beds. And then this is the high and low counts of the beds. So low count, high count of beds. Hospitals apparently don't know exactly how many beds they have. And then the percentage occupied.
Percentage of staffed adult ICU beds.
The low and the high. And...
oh my gosh, dude.
yeah.
I really wish you'd have sent this to me so I could have fixed it.
This is from a government website.
This is it's going to bother me.
Anyway, so down here. Oh, no.
You can organize it by date, you know.
That's what I want. 12/3. Countrywide. 77, 75, 78%.
Huh. So you're saying that we're under the 80% that everybody says that we need to be under in order to not be locked down.
This is countrywide. Now, state by state, there's some that are higher. There's 80. There's some that are, 50.
Do you have the averages from previous years that you can stack next to this?
I have them in an article, yes.
Oh, hey.
So there's that. Don't save. Don't save so. Don't save so close to me. Here's
They might
one.
be trying to screw me.
Well, of course they're trying to screw
Here's one
you.
other one. So this is a little more comprehensive.
Okay.
Stuff. Let's see.
Okay, so
So this is 820. Is it? This whole sheet. This one's huge. It's January 1st to 820. It's a collection of stuff until August 20th from the 1st. So let's see. We are here in Utah. There you are. So there are 5 hospitals that are reporting a critical staff shortage. I wonder which 5 hospitals.
my guess is
a critical shortage.
LDS Hospital, University of Utah, Dixie State,
And then the 2 IHC
Utah
hospitals.
Valley Regional, and IHC.
Yeah, and that's a common trend with Utah. Further down the list, there's more dates with Utah, and it's 4, 5, 4, 5, 4, 5, 5, 5, 4, 4, 4, blah, 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 blah. And in the next week, there's 4 hospitals that are expecting a critical shortage.
Also funny to note that I believe that those 5 hospitals are the ones that have laid off the most nurses since the beginning of the pandemic.
We don't talk about that.
Anyway, just saying.
So the number of beds, inpatient beds, in the entire state of Utah, 5,491. And so this number here, the 52, that's 52 hospitals reporting the previous number. That's what that is.
Huh.
So there's 52 hospitals in Utah. The occupied beds, total occupied inpatient beds, 3,196. So we're sitting at about 60% in Utah. But, hospitals are getting crowded. They're getting filled right up in Utah. And then there's the COVID. So of those inpatient beds that are COVID related, and 159.
That's 58%, by the way.
It's just shy of 60.
3196.
So of that
out
30 of that
5491.
3196, 159 are COVID in the entire state. So that was just beds with people in them.
So of that 60%, 5% are COVID patients.
And if you do that as a percentage of total beds, that's less than 1%, right?
Let's see. The total was 50 what?
5491.
That would be almost 3%.
3%.
It's 2.8 or 2.9%.
Let's shut everything down for 3% of the beds occupied by a deadly disease, except it's not deadly at all. Further down the list, we have so the next few numbers. This is previous numbers added, it's subtracted, blah 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 from the last report. Staffed stuff. Let's see. Adults. There's your adult numbers. Total adult patients hospitalized, confirmed, and suspected COVID.
Oh, so it's both the confirmed and the suspected.
Both the confirmed and suspected. 143. And then
143 out of 159 are adults, huh?
confirmed. These absolutely are confirmed cases. 124 in the hospital.
Wait. Huh?
124 confirmed adult cases in the hospitals in all of Utah.
What? As of, what was this, the 20th?
Yeah.
Of August?
Of August. I have Should we just go to?
Is there a more recent one?
There is. I have December 5th here.
Oh, let's go look at December 5th because I'm interested. I'm intrigued.
You have my rapt attention.
You had my interest. Now you have my attention.
We'll go down here. Utah is number 47.
We have 7 hospitals in that one.
Let's shrink all these up so we can just see Utah. And then you can go back. I will provide the link. And you can look at your own state and country and get mad.
Well, not your own country because we only have the United States.
Well, you can still get mad at it.
Okay. There we go.
That makes it easier, right?
Yeah, it makes it much easier.
Just look at...
Let's just look at Utah here. Okay.
Just get Utah.
There we go. Oh,
Quick
wow.
fix.
Wow.
So 7.
Wow.
7 are recording. Wow.
Wow. Wow.
Be a lot cooler if you opened up.
Wow.
So there's 7 hospitals now reporting critical. I can guess what 5 of those are.
What are the other 2?
There's one reporting. There's one hospital did not report today of if they have critical staff. That's what that is. 7 are reporting a shortage in the next week. Here's your inpatient beds. Oh, look, there's more beds.
Huh.
They've got 1,000 more beds.
Wow.
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 Wow. To put this in a little bit of context, too, because I'm going to go into some stuff from previous years. So hospital capacity. I don't know exactly what they mean by hospital capacity anymore because, at least here in Utah, the University of Utah said that they are capable of operating at 200% capacity.
Huh.
So when it says you're at 100% capacity, are you actually at 200% or are you at 100%?
Wow.
So that is not made clear in all of this.
At all.
And
I can tell you what percentage of the beds they have filled.
Oh, how many is that?
59.
59%. 1% higher.
59.1. It's actually lower.
I thought it was 58.2.
It was almost 60 before. It was like 59.8 before. It's now 59.1.
So it's
lower. It is lower than it was in August.
And we have to wear a mask everywhere we go in Utah.
I mean, granted, they also increased the number of beds.
I don't care.
By-
If you increase capacity, that's your own fault. That's not...
I mean, not quite. They increased the beds by 700 beds, and they only had the number of used beds go up by 470.
Oh.
469. There's only 469 more used beds right now than there was on August 20th.
And to be clear, this is just used
As-
beds. It's not
as
COVID.
of
This is
3
not
days ago.
This is not the COVID number yet in Utah.
No.
This is just
inpatient
beds. This is someone's got a bad stomach ache and they're at the hospital and they're getting whatever antacid to get it fixed.
This is,
Buckle up, Buttercup, because this is
I
just
believe,
the beginning of this
infuriating is the word that I'm looking
the
for.
wrath of a
right
million
here.
suns are about to come crashing down. So now here we get COVID. Here's your
COVID
COVID
beds.
used 599.
Well, it was only 159 before, so that's gone way up.
That's gone way up. Let's see. Here's one. Here's a
So that's gone up to 9%.
9%. Mm-hmm. Where's the pediatric suspected previous day?
1 pediatric suspected.
From the previous day.
Oh, okay.
Yeah.
58 total? Is that what that one is?
Previous day admission pediatric COVID confirmed coverage. So 58 hospitals.
59 total with the 1 suspected.
Well, no, this is 58 hospitals are reporting
oh,
that they can cover pediatric.
58 out of 52 hospitals have
exactly my
said.
So somehow they've qualified more hospitals to be on this list. So there's your previous day adult admissions, 58 hospitals. Are
you sure that's hospitals?
Yeah, this number's not previous day admission adult. So 58.
58 is the actual
58
number
came in since the previous day.
Yeah, of people that come in, and they aren't reporting discharges on this. It doesn't look like
they kind of are, in that they show you what the previous day was, and you can follow it date by date.
Huh.
But yeah. So now here's the ICU. This is where they're really pushing everything. The ICU is full. At first they were saying the hospitals are getting full. Then they started saying the ICUs are getting full.
491 out of how many?
490.
Where's the actual total?
No, so this is the total number of staffed ICU beds, the occupancy of ICU beds. So 491 total beds can be staffed. And 199 have patients that are confirmed or suspected COVID. So
that is 40.5%.
The ICU is full, though.
That's what I've heard.
There's confirmed. That's the hospitals. That's right. Here's your confirmed 199. So none of them are suspected. No suspected. They're all confirmed.
All confirmed.
It's
What's that 59 then?
That's your coverage. So an extra hospital from somewhere is reporting. Total adult patients hospitalized, confirmed, and suspected COVID. So 584. There's your number.
Only
there.
199 of them are in the ICU.
Uh-huh.
ICUs, because this is statewide.
That's 30-40% off the top of my head, 40-something%. Adult total, that's the coverage again. Total adult patients hospitalized, confirmed COVID, 568, so 16 less.
Wait, 568 out of
584. So this is confirmed.
No. I mean 568 confirmed cases, 568 people taking up beds in hospitals, and that's out of the 6,200 for the entirety of the hospital beds. That number would be.
Yes. Yeah.
That's 9%.
Overfilled. Here's the pediatric. So, kids, we've got to keep the kids safe. Got to keep them out of school.
So the other 31%, the other 31% of beds taken up in Utah hospitals is something else.
Yeah.
But COVID is our...
COVID is just running
COVID
rampant.
is just running rampant on us.
Total pediatric patients hospitalized, confirmed, and suspected. So these are your 18 and under, basically. Your pediatric, whatever's considered pediatric. It's probably actually like 12 and under, I think, is technically pediatric. I think. I could be absolutely wrong. Mike is typing to confirm. But there's 15 suspected and confirmed. And...
15 or younger.
15 or younger. So the total confirmed, 1. 1 out of 15.
1
is confirmed. And
but we have to protect the
and
children.
That's 58 hospitals reporting in the state of Utah about that. And it's okay because total staffed, they got 636 beds staffed in the ICU. So, yeah.
636 beds, huh?
So 199 is...
That is 31% of their ICU beds are COVID. And how many total ICU beds did they have taken up out of that 636?
200 with COVID.
With COVID?
With COVID, too.
What about without COVID? Do they have the number of how many Beds, okay, right there, 491.
No, that's staffed again. Staffed adult ICU bed occupancy.
Right.
They don't tell you how many are actually occupied by other things than COVID.
No, but that 491 would include the COVID, wouldn't it?
That 491 is
Staffed adult ICU bed occupancy. So that's all of their staffed adult ICU beds in total that are occupied. So
no, that's their occupancy. That's how many they can have.
I thought that the other number was how many.
I know.
The 636.
It doesn't make sense. Total staffed adult ICU beds, 636. But their occupancy is 400.
Doesn't make any sense.
Huh. Here's percentages on inpatient bed
So
utilization.
your bed utilization is 60%.
What's that? Oh, that's telling you the numbers they pulled. Of inpatients with COVID,
16.5.
16.5%.
Almost 16.6.
It's a lot of the same. This is just showing percentages that Mike did on the fly.
Yep.
Yeah. So it's a lot of this same garbage across every single state. I was just doing a quick glimpse through there. But you can go to, yes, don't save. Sorry, what?
No, that's fine. You already closed it.
All right, don't save.
I was going to have you look at the 31% one because I think that was the number I just barely ran, which was...
Oh, no, this logged in your stuff.
Oh, no.
Oh, no.
Oops.
Oh, we're still recording, so we're fine there. Hold on. This is going to drive me crazy. It drives me crazy.
It was the only way to get it all to work.
There, fixed it. Oh,
No, you didn't.
this will probably fix it on all your other devices, though. Since you logged in here. Suck. Yeah, and all of this is from the not that one. Now I got to pull all my stuff up again. All of this is from the HHS website. I don't think I have it in my stuff.
I don't think so. You have health data and a bunch of other stuff on it. Oh, shoot. So many things.
Health data, yum. There you are. Yeah, here you go. This is what the site looks like. So you can go here, you can find data coverage report, you can find the inpatient impact, hospital capacity by facility, estimated patient impact and hospital capacity by state, time series, more capacity by state of California, blah, blah, blah. That's other stuff. But yeah,
So-
you can find it all there, and you can find the previous stuff as well. So every 3 or 4 days, they collect data and put it out. You can get all that data and compile it together. So if you're really wanting an Excel homework of putting a graph together, there you go.
What do you think? That's what they do. They can make up anything.
Yeah. So either the HHS is lying, or the states are lying to the HHS, or all of them are lying. I'm going with C.
So, did you lie or did Comey lie?
Exactly. So I mean, still, you can look at that and say, well, 70%, 80% is pretty bad if we got this virus that's running rampant through the thing. You're not wrong, but you're wrong because I lost my page again. There you go. Because in health fairs, right? Health affairs. Mm-hmm. Because way back in 2009, was this? 2003. Way back in 2003, they were wondering if hospital capacity needed to be expanded in 2003.
Interesting.
And part of that was because, hospitals were showing that they were across the country in 1975, for example, it was 74.9%. But then in 2001, when this study ended, 64% nationwide was the fill. So hospitals were actually kind of doing pretty well, more or less, when they did this. So on average, the country, just based off of this, the country's hospital fill is 64% of inpatient occupancy. On average. That was way back in 2003. We're 2020, right? We need something closer. We need something that happened in, like, say, 2017.
Yeah.
Yeah.
That sounds good.
That's closer.
Yeah. See? Yeah.
Yeah. Get your COVID lies off the top of the screen.
Wow.
This is the National Library of Medicine and the National Institutes of Health. It came up with this report, Critical Care Medicine Beds, Use, Occupancy, and Costs in the United States, a methodological review. In this report, they find that ICU beds accounted for 15% of the hospital beds and were estimated, let's see.
Occupancy rates
were estimated at 68% in 2005. That's pretty on par with what we just looked at. And then you fast forward a little bit to... I was wanting to print this out earlier so I can just highlight and read. But we're going to have to do Control F.
Do the magical search.
80%. I'm looking. There it is. We recognize occupancy, blah, 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 blah. I read these before, so it's not like, bleh. But, so they broke it up by ICU. They found that surgical ICUs were 79% filled on average. Federal hospitals, 80% filled, the ICUs. And ICUs of hospital beds with 301 to 750 beds were 77% filled.
That sounds like...
That sounds almost like it's worse than what it is right now.
Huh.
This was 2017.
Interesting.
Interesting indeed. Where they had less beds back then. They had less beds. Yes, but again, the University of Utah said they're capable of operating at 200% capacity. So are they at 180% capacity or are they at 50% capacity? Which is it? But you know, let's try to get a little earlier, shall we? A little closer to now, like February 22nd, 2019. Bad flu seasons test U.S. hospitals. In this, they report that there's ICUs and stuff like that were stretched to the limit. And they say here an estimated 959,000 people were hospitalized from the flu.
79,400 people died
of the flu
last season.
And that's something that's interesting because there's flu seasons. There's a season for the flu. The CDC keeps track of flu season. Not flu year, flu season. The death is, you can't compare it to the flu. The death rate is different. Well, if you compare it season by season, it might actually be a lot closer to the
also
same.
Interesting. That is an 8.2% death rate. Which means that if you catch that flu, you only have a 92% chance of surviving as opposed to the 99.8% chance
and this is with
that you have with COVID, and that's with a vaccine.
This is with a vaccine that's 30% effective. And I don't think even half the country takes it.
But the lockdowns are for your health.
It's for your own good. You want to know who helped contribute to this article?
I don't know, but
you
this
want to
episode
know?
is going to get taken down by every social
I
media that
don't
we posted
care.
on.
Let them. I will repost it and repost it.
Every single one is coming after us after this.
Someone is helped contribute to this.
We could post it on Rumble. Michael
I'm
T.
fine.
Osterholm.
Does that sound familiar?
It does sound familiar. Why does that sound familiar?
He's the guy that's on Biden's team that points out that there's a lot of money in people's savings account right now. And
that
we
guy.
We can shut things down and take money from your savings to pay you with your savings
That guy.
during your shutdown.
The guy that broke me a couple
Yeah.
weeks ago on one of our episodes.
Yeah.
Yeah.
So I saw that and I started questioning, wait a minute. Something in here is lying. And I found the lie. If you go to the CDC and look at their previous flu seasons.
Oh, hey, that's kind of nifty. Look at that.
Yeah, look at that.
It's almost like the internet goes forever.
Almost like that. Almost. What was it? 900 something thousand?
Yeah, 959,000 hospitalizations.
Medical visits, hospitalizations, right there. 2017 and 2017, 2018 flu is what they were covering.
Yeah.
Oh,
810,000?
Wait.
Wait.
Oh. Well, I mean, that's an estimate. There's the 620 to 1.4, so.
Yeah, that's a whole 149,000. I mean, there's almost less infections right there
So
than there was votes for Biden in that one dump.
So here's the infections though. The infections was 45. Oh, that's less than what they actually reported on that thing. I don't know if we covered it, but it's in there. There's the deaths right there, 61,000.
60. That's less deaths
Yeah,
by like 18,000.
that's their estimate from 46 to 95,000.
Huh.
So I don't know where they think they're getting their information from, but according to the CDC, which is supposed to be the end all be all for this kind of data, doesn't agree with them. But regardless, hospitals were full.
Oh, wait.
Let
me look at. I wanted to look at something real quick. So they had. What was the number of deaths that they had listed there?
It's
61,000.
61,000.
And how many total infections did they have?
45 million.
45 million?
I think so. Let me.
Because that changes that number that I had before.
That
So
you were going off hospitals.
I was going off hospitalization. So it was 9% of the hospitalized.
Yes.
So if you're 45 million, that changes the game a lot.
A little lot.
So I want to be accurate. That puts it at a 0.13% death rate, which is almost the same.
You can't compare the flu.
You can't compare the
and
flu.
coronavirus.
I mean,
they're not the same thing.
According to the CDC's latest release, COVID is approximately 0.7% more deadly than the flu was in 2017.
And that's without fully understanding how to track coronavirus.
Yeah, I was going to say, and that's with the way that they've been reporting the infections of
Yeah.
coronavirus, which is utter bullshit.
And so to go back to flu seasons, when exactly is flu season?
Winter?
October through March is
Oh.
flu season.
Hey, look at
That
that.
is when flu is recorded. October through March.
So winter.
Winter. 6 months is where that data comes from. Not 1 year, 6 months.
Huh. Wow.
So when's Rona season?
All the time.
All the time. Flu season.
It's
Rona season.
It's Rona season until you
Rona
die. Haven't you listened to the news?
You just want people to die.
You just want people to die.
Yeah. But, related to that, apparently, the flu doesn't exist anymore.
Oh,
Flu hospitalizations this season are too low for the CDC to run models on the disease burden. Yeah.
it's almost as if they're getting reported as something else.
It's curious. It couldn't be that they share the same proteins as coronavirus.
No, couldn't be. Couldn't be at all.
Could not be that at all. So, if anything, you need to thank Donald Trump for curing the flu. Finally cured the flu. That team has been working real hard.
Also, if you were to remove the number of deaths that would be attributed to the flu from the number of deaths that have been attributed to COVID, it makes the survival rate go way up on COVID.
Yeah.
Just saying.
Yeah. So that leads into the final section. Dun, 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 dun,
Oh,
dun, dun,
yay.
dun.
We're so excited.
This goes into the Nancy Pelosi category and the
Lich Queen.
yeah, and the news just not caring at all about you. The CDC has put out new quarantine recommendations. Did you see this?
I have not.
They've reduced the number of days that you need to quarantine.
Oh, good.
So it's not 10 to 14 anymore. It's 7. 7 days.
Huh.
7 days to quarantine. With this extremely virulent, extremely contagious, extremely deadly virus. 7 days is all you need. There's science behind it. Reducing the length of quarantine may make it easier for people to follow critical public health action by reducing the economic hardship associated with a longer period, especially if they cannot work during that time. That's their science. We went from 10 to 14 because viruses as a whole are contagious for about 2 weeks after you show symptoms. But after studying coronavirus more, we've decided that if we do 7 days, you are more likely to comply. The CDC has abandoned science.
Well, I mean, arguably, that's to abandon something. They would have first had to have supported it originally.
Oh, they did. They did originally support it because back with the swine flu, they found that face masks and respirators, they can help reduce the virus transmission, but only if you're sick.
That almost sounds like I read the show notes and was leading you into the next section.
Almost. It's almost.
We
as
don't
if
want
we're
to
a
give
little
people the
intended.
wrong idea here.
we are-
I did not read the show notes.
We are dysfunctional. Dang it.
Functionally dysfunctional.
So in this, they say wash your hands, cover your mouth, don't sneeze on people, don't touch your eyes.
Avoid being within about 6 feet with
Blah,
persons
blah,
with
blah,
illnesses.
blah. This is where they pulled all their initial stuff for the coronavirus.
Or
and I mean all initial stuff, because you can go back and watch go back and listen to or watch Liars, and you will hear Anthony Fauci saying lying Fauci. That
Darth Fauci.
Darth Lord Fauci. Unlimited quarantine. Ah!
Trump, I am your doctor.
but you will hear him talking about how face masks don't work because there's all kinds of holes for the virus to get around. And in this report, you will find them say that. Let's see if I can.
You will find them say,
Control F this.
Control F this.
Let's search for corona. This was back again. This is 2009 when they put this out, and I'm going to search. Oh, they got rid of it. It was in there. Anyways,
Oh.
I might have to.
You might have to Wayback Machine this
might
one.
have to Wayback Machine this, but it points out that the masks don't block coronavirus in 2009. Actually, it might have been the 2003 thing that I had. I think that's what it was. The
Does it say
2003.
SARS? Because COVID is a SARS strand.
That's true. Yeah.
So if it says SARS, it's the
says
same
SARS.
thing.
Yeah. It
Nope, doesn't say SARS either
It's another
anymore.
study I was looking at. But yeah, they point out that the masks work if you're sick. They don't work, but they can reduce stuff.
Keep your interactions with ill persons as brief as possible.
Yeah.
The ill person should be asked to follow good cough etiquette and hand hygiene and to wear a face mask if able, and one is available.
And in the occupational healthcare setting, respiratory protection is recommended because infection control precautions, including respiratory protection, are imperfect.
This is like this. Literally, like looking at this, it looks like they took a picture of something that they were supposed to turn in for a homework assignment, and instead of turning in the actual picture, they turned in the negative. Because they literally just inversed everything that they said on here and did that. This says ill people should avoid groups and avoid being out in public. And so what they did was they locked down all the healthy people.
Mandatory
Seriously,
use of
though.
respiratory protection may be required when work activities and occupational settings confer risk that is task function based, and risk analysis conducted by the employer could identify hazardous work activities. For example, performing activities which generate large amounts of aerosols require respiratory protection regardless of the setting in which it is performed.
Like a strip club.
Like a strip club.
The examples they use are hospital, outpatient settings, and prison.
Does that?
But, I mean, how is prison a better example than a strip club, if we're being real here?
And then they point out the higher risk people, children, old people, pregnant women, blah, 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 blah.
Adults and children with asthma.
There's all the tables, data of stuff
Ooh,
that
look at that.
the CDC used to believe until they decided that.
It really is like they turned in the negative of their project.
Yeah.
Like,
We need you.
did
We
these-
need you to debate this. All right, I'll give you the counter argument. No, I need you to debate for that. Anyway,
Goodness.
so Rand Paul,
Rand Paul.
God bless his soul, he says that Anthony Fauci owes an apology to every single parent and school-age child in America. Why? Because the tart face Fauci said
Flip flop Fauci.
recently that we need to close the bars but open the schools. Where just a couple weeks before that, he was advocating we got to close the schools again because children are at risk and blah 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 blah.
Let's see how often I can go back and forth on the exact same topic.
Thing. In fact, he flip flops so much, the Washington Examiner pulled some of the flip flops.
Oh, that's awesome.
And let's see. See, in November, that's what I just covered. On March 8th, he described lockdown measures in China as draconian, and stated that such restrictions wouldn't be feasible in the U.S. more than a month after the World Health Organization had declared a global health emergency on January 30th. So he was against the lockdowns, and now he's saying you shouldn't travel. Speaking of, I about lost my mind again before we started this because on my Facebook feed was Kamala Harris, Joe Biden talking about their COVID plan, blah, 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 whatever, garbage. And Fauci's big, fat Fauci face was sitting on a screen above him. And he's talking about how it's great things and I'm really excited because a good friend of mine is receiving the Nobel Prize for Science Award, blah, blah, blah. So I had to pre-record this message so I'd be able to go to his ceremony and support him in receiving this great award. You son of a female dog. He just I'm not even kidding. A couple weeks before was on board with, you're going to have to stay home for Thanksgiving. You're not going to want to travel if possible. Try to avoid any unnecessary
It's better to
travel.
have a Zoom Thanksgiving than a COVID Christmas.
Yeah, so shut it, Fauci. You are discredited in my eyes long before this, really. But
I was gonna say, this is what broke the camel's back, because
this is the
he's been on my shit list for a while.
the final nail in the coffin had been laid long ago. I'm just putting more nails in it just to make sure he doesn't come out.
We have stopped driving nails around the lid, and at this point, we're driving daggers through the top.
Yeah, so he can breathe.
That's right. But we're leaving the daggers in there in case he's still alive. And
Yeah.
if he startles awake, it will finish the job. It'll be fine.
And some of these things we pointed out on our Liars episode, a lot of this goes back to Liars.
A lot of it.
Days later, on March 15th, he changed positions and said he was open to a national 14-day shutdown to help stop the spread.
14 days to flatten the curve.
I am open to closing everything.
In April, when pressed in a CNN interview on why social distancing and lockdowns weren't implemented sooner, he sparked confusion when he said more lives obviously could have been saved if there hadn't been pushback to lockdowns at the start of the pandemic. Very next day, he backtracked, saying that he used the wrong choice of words. September, Fauci testified he did not regret saying that the only way to stop the explosion of infection was by shutting down. Perhaps Fauci's most notable flip-flop has been on the efficacy of masks. Saying in March that there was no reason to wear a mask, by April he joined the chorus of doctors and health agencies encouraging the use of face masks. In April is when it became Donald Trump's fault. I am amazed he has not been fired, because that's 100% in Trump's character. But I also understand it. If he fires the COVID director in the middle of the pandemic, not going to look good for him for an election.
Right. Yeah.
If it was not an election year, bye-bye. Gone.
Well, I mean, at this point, I don't know why he didn't just fire him after
yeah, fire him now.
After
Get him
the
out.
news declared Biden the winner. I'd have been like, all right, Fauci,
You're out.
Fauci yourself out of the building.
Fouch yourself on out of here. Fouch out.
Fauci off.
Fauci also previously downplayed the virus itself, something Trump was harshly criticized for. No.
What?
Saying in February that
Not like we just talked about that 5 minutes ago.
the public should not be frightened. Come to Chinatown. People should not be frightened. They should carry on with their lives. They should not change anything in what they do day to day. By March, he was singing a different tune, warning people that they needed to do their part to stop the spread and take the virus seriously.
You guys, we need to take this seriously. Like,
Yeah.
for real.
He also said asymptomatic transmission, people need to realize, is that in all the history of respiratory-borne illness, asymptomatic transmission has never been the driver of outbreaks. Asymptomatic transmission has never been the driver of outbreaks. He gets that information from studies done by the CDC previous to 2019. And he's right, because you can't transmit something that's not replicating itself within you. If the virus is replicating, you are sick. You have a fever. You have runny nose. You have whatever your body does. By August, Fauci did a complete 180, saying asymptomatic cases were a driving factor in the community spread of COVID-19, despite a WHO admission that more evidence was needed to make this determination. In late August, researchers from Southern Medical University in Guangzhou concluded that asymptomatic cases were least likely to infect their close contacts. And it goes on. Related story, you can find this, it'll be in the links. Related story, personal story that helped tip this all off for me, happened actually recently. And this person does not listen to or watch the podcast, and I doubt they ever will, because they're not talking to me anymore.
That's a good reason for them not to listen to or watch this.
Yeah. So at work, the mask policy is basically, if someone's nearby, cover your nose and mouth, and if nobody's nearby, don't worry about it. And then, wipe down your stuff, whatever. Be clean. So I'm sitting there doing my thing as a machinist at where I work. I set up machines for the operators to do. So I'm in the machine. I've got my mask sitting around my chin so I can actually breathe while I'm inside of this machine, putting tools in, all this stuff. And one of the operators comes up to me, the one that's going to be taking over the machine when I'm done, comes up to me and says, "Could you put your mask over your nose and your mouth for me, please?" I lift my mask up over my nose and mouth and turn to her and says, "I'm not contagious anymore," because if you're just tuning in, I had the Rona, apparently, a few weeks ago.
Yes.
I thought it was allergies, and I took an allergy pill that, in the ingredients list, actually, I looked at it, has a hydro-related ingredient in the active ingredients. Like
Hydroxychloroquine related?
Yeah. Interesting. Anyway, I took allergy pills and symptoms went away. So I didn't think anything of it until my wife got tested. She came back positive, so I went tested and blah, blah, blah. Anyway, I get back to work, and she asks, "Can you please cover your..." And I turned to her and said, "I'm not contagious anymore. I can't transmit it anymore, and I am immune to it for at least 90 days. And I don't know all that, but it would just make me feel better if you did that. So when I'm nearby you, I'll put a mask on if it makes you feel better or whatever." She said thanks and blah, blah, blah. I go and get back to work, take my mask back down so I can breathe. And then I look off to my left, and I see her talking to two people that are not wearing masks at all, laughing, giggling, yelling, whatever, for 30 minutes. So she went out of her way to come to me and ask me to put a mask over my mouth, and then went out of her way to two people not wearing masks at all, not even around their chin, to have a gay old time about whatever. And then she comes to me again, a little more sternly, "Trevor, please put your mask over your nose and your mouth." Strike 3. We went from ball 1 to strike 3 pretty quick. Didn't help her that I've just went through all this stuff over the weekend. Mm-hmm. But I was nice and cordial the first time. It was all fine. And preface this, before I had the Rona, we were buddy, laughing, joking whenever possible. I lift my mask up, turn to her, and I say, "Did you ask those two other guys to cover their faces that you were talking to?" "Who was I talking to that didn't have a mask?" "So-and-so and so-and-so did not have masks at all, and you were over there for 30 minutes talking to them. Did you get mad at them for not having... Did you ask them and get mad at them for not wearing their mask?" And she says, "Well, I have a son that's high risk. I'm high risk. I have asthma. I technically shouldn't even have a mask. I'm exempt. But I have to wear one because people get concerned if somebody doesn't have a mask." And she kind of walks off in a huff. I walk over to her and said, "My issue is you are not being consistent." Called her out on her hypocrisy. She has not talked to me since. It's been 2 days.
Good. You don't need that
I don't need
negativity
that
in your life.
I don't need that in my life, and I'm pretty sure she's talking about me behind my back, because whenever I turn and look and she's talking to someone, she's pulling her mask kind of aggressively and waving her arms in the air, whatever. Fine. Let it escalate. This will be fun. I was in the right. I even confirmed with HR. I didn't tell them about the situation. I just went to confirm the mask policy with HR at work. They told me it. I was following it to a T. I am fine.
Well done.
Anyway, carrying on to the experts and leaders that really don't know what they're doing. Well, they know what they're doing, but they don't know what they're doing. Lord Lori Lightfoot of Chicago.
I think it would be Lady, wouldn't it? It's a female. It's Lady Lori.
She's not a lady.
Okay.
She does not deserve the title lady.
So she's a man?
Sure.
Well, she's a guy, so...
She's a guy, so that's not what I want. These hypocrites are trying to tell you what to do, and we're just bending over and taking it. This was...
Bend over and take it up the tailpipe.
This was a while ago, when Chicago shut things down. April, there we go. Chicago had shut everything down, basically, because of Mayor Lori Lightfoot. And her stylist tweeted out how wonderful it was to work with the mayor and trimming her hair and making her look all dolled up. Look at her, all prettied up. She a doll.
Well,
Yeah. She
sometimes you gotta, just
in
shape that Chia Pet top.
Yep. In one of her PSAs, she said that getting your roots done is not essential. Roots to her hair. Roots, it's not essential.
Nope. Not essential.
However, the controversy, this is from NBC, super conservative NBC. The controversy began when the stylist posted photos with the mayor on Facebook last weekend, thanking her for her hard work and saying that she had the pleasure of giving Mayor Lightfoot a hair trim.
Just a little bit off the top.
In defense, the mayor said the stylist was wearing a mask and gloves. The mayor said in defense of her haircut during a press conference earlier this week, "I'm the public face of this city. I'm on national media, and I'm out in the public eye."
I feel like we've had this news story before. When was this one written?
April 11th.
I
We probably did cover it then.
was going to say, we probably covered this one.
So haircuts for me, but not for thee, because I got to look pretty because I'm in front of a camera. We don't look pretty, and we're in front of cameras. You're fine, darling, if you don't get a haircut.
I don't know what you're talking about. My beard is glorious.
I feel pretty.
Oh, so pretty.
Your
I
your
feel
beard can
pretty and witty and very not gay.
your beard can look fine and fabulous, but it's just that.
You just gestured to all of me.
Kind of ruins the beard. Now we have Grand Duke Gavin Newsom. Newt. We should turn him into a newt. He'd be more useful.
Yeah, I hear that their eyes make great potions.
He was spotted at a French restaurant not following the COVID-19 protocols he had just implemented, I believe, the day before. This was November 17th, so very recently. There he is, highlighted there. And this guy right here, sitting next to him, is the health official for
So they don't share a household, obviously.
They don't share a household. This was his friend's, a longtime friend's birthday party.
Okay.
That was his defense.
It's okay because it was a friend's birthday party.
Yeah, he tried.
Well, that's the defense I'm gonna use then.
So this story. What's fun about this is this story broke, and his defense was, well, it was outside, and then the picture showed up, and it was supposed to be outside. And then when they absolutely had him dead to rights of not following the mandates that he is forcing on the citizens of California, he said, "Yeah, I made a mistake." Yeah, you did. You did, bud. You made a big mistake. And health officials were also there. These two guys are the health officials for the state that helped write the lockdown orders of not going to. And, if they can't afford burgers, let them watch me eat a $300 plate. Because that's how much it costs to eat at this place. $300 a plate for this restaurant.
I don't think I've ever paid that much for multiple plates.
Whenever I want multiple plates, I just go to a buffet.
I buy lunch for upwards of 10 people at work, and our bill usually comes to about $110.
So you're not going to French Laundry to...
No, we like Costa Vida.
Yeah.
It's a little bit cheaper than where he's eating.
A little bit.
I can't afford the burger, so I got a salad instead. Because it's more expensive.
If they can't have a burger, Let them watch me eat a $300 plate. And then we have Sir Steve Adler, who he's the mayor of Austin. This is December 2nd, so we're getting even closer to today. He essentially said, stay home because Mexican timeshares are not worth the risk, as he's in Mexico telling people they need to stay home. He broadcast his message of staying home while he was in a timeshare
Cabo San Lucas
in Mexico. Mexico is one of the worst countries in containing the coronavirus. But
at a wedding.
It's fine because he was at a wedding. It was important. Your funeral that has 10 people, not important. George Floyd, who has a funeral, very important to stuff 500 people into that thing. But your grandpa that died, yeah, you can't be gathering together. Only 5 of you can maybe be there if we allow it. 10 of you if you're outside. Yeah.
This is not the time to relax. We are going to be looking really closely. We may have to close things down if we are not careful.
While I violated no orders or guidelines, I regret this travel.
I think I have actual recording of him saying this.
Yeah. Yeah.
That's it was a translation.
Yeah. I wouldn't travel now. I didn't travel over Thanksgiving, and I won't travel over Christmas. But my fear is that this travel, even having happened during a safer period, why is it safer? Because it's the day before you said to do it? Is that why? And then we have Monarch Michael Hancock from Colorado.
He's not allowed to have the name Michael. I refuse to let him abuse it.
He's an imposter. He's
an imposter.
He's a mayor in Chicago.
It's not a real Michael.
This is what he tweeted out on November 25th. At risk for COVID, shop and eat locally, blah, blah. Shop and eat locally. I know we've shut down all the local businesses, but shop locally.
Order in from a neighborhood restaurant or buy a gift card for someone else.
Yeah.
But
the one that really made people angry was avoid travel. If you can't mask up, stay 6 feet from others, wash your hands thoroughly and often, feel sick, cancel your plans. He tweeted this out literally as he was about to board a plane to go out of state.
The plane travel thing cracks me up too. You literally have to go get tested and quarantine yourself before you get on the flight. And then they make you wear a mask for the whole flight, knowing full well that you aren't infected.
And the Air Force did a study on how clean airplanes are, and they found that the potential for someone catching coronavirus on a flight is almost zero, with nobody wearing masks. Because, it's this amazing thing that a sealed can way up in the sky has purified air flowing through it. Airplanes are almost clean rooms. Almost. They're almost as clean as a surgical room, which is a class 10 clean room.
Really?
Yep.
I didn't realize they were that clean. I would have thought they would be much dirtier than that.
I would have thought so too, but the Air Force said because of the filters and the way that the airflow works in the thing, the airflow in a plane is much like a clean room where it's a downward draft. So all the air is constantly circulating and everything gets pulled to the ground.
Huh.
So any droplets that come out get
Well, the
sucked down to
military
ground.
said it, so it must be true.
Yeah. And then, so this is the shop from home. Last year, the enemy to every liberal, Democrat, whatever, every anti-capitalist was all these big, greedy corporations. Places like Walmart and stuff, they're just taking advantage of the worker, and they're not allowing all these smaller businesses to flourish and la 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 la. And then 2020 happens and everything gets shut down except for Walmart and Target and all these big chain retailers. Sure. The little mom and pop market there that sells most of the same groceries that are found at Walmart. You can't go there, but you can go to Walmart and get your groceries. You can't go to the furniture store because furniture isn't essential, but you can go to Walmart and buy furniture. You can't go to your favorite little hole-in-the-wall clothing store because clothing isn't really essential right now, getting new clothes. But you can go to Walmart and buy new clothes. You can't go to the mom-and-pop restaurant, diner, whatever, that's been a staple of your community for decades, that's got really amazing food, that's got your favorite sandwiches. You can't go there because, they can't keep it safe. But 500 of you can go to Walmart and buy food. And, hey, there's a McDonald's there, too. You can buy food at that McDonald's that's inside the Walmart. You can do that. And if they don't have a McDonald's there, you can just, go to McDonald's and get food at the McDonald's. That's fine. You can do that. Walmart announced December 3rd that they are giving $700 million in additional bonuses this Christmas to their employees and associates.
Oh.
If you really want to end all this garbage, you need to, one, hold these hypocrites accountable, because that's the only way they stop. This is what happened at work. This lady, if I did not say that, she probably would have came to me a third time and maybe even complained to someone. But because I pointed out her hypocrisy, she's not talking to me.
Well,
she's leaving me alone for now. And if she tries to bring it up more so, I know that I was following the rules. Also, I have apparently science on my side showing that I'm the safest person to be around at the shop. As far as COVID's concerned. If the science is correct. And then on top of that, stop shopping at these big chains. Stop it. Because these big places, they only answer to social justice retards and money. Those are the only things they answer to. So if you stop buying your groceries at Walmart and go to whatever mom and pop little thing, it's more expensive to do that. What's more expensive? To lose those mom and pop things, those small businesses that are the heart and soul of the economy in the United States? Or missing out on 10 cents off bananas at Walmart? What's more important to you? Do you want to, because a lot of these big chains, if they start not making money because people aren't showing up, one thing Walmart is doing, at least in Utah, more and more Walmarts don't have the mask signs on their doors. Mask is required to enter the store. They're getting rid of that. Why? Because at least in Utah, a lot of people are resisting the mask. I am 100% there. Mm-hmm. I'm only wearing one at work because they're paying me to wear one.
I only wear one if I walk into a store that requires it.
Yeah.
And I need to go shopping. That's pretty much the only time I ever wear them.
And with the stores.
And even then, I walk in past the person that is checking at the front door. And if I'm more than 6 feet away from anybody.
Right. And even then, I check if at the front of their store they have.
I do too.
Local law says this, this, and this. I'm not doing it because it's not a law.
Right.
If
most of them around here have switched that. They don't say that anymore. They say store requires.
Right, because people were pointing that out to them.
That it isn't a law. Yeah.
But yeah, that's the only way you end all this is to push back. And that's what they're doing in New York. That's what that lady was doing. We showed in the last episode.
Mm-hmm.
Ish. Pushing back. At least pointing out the fallacies. That's the only way. You have to hold these people accountable because they think they're above everything. Mm-hmm. All of them. They think they're above everything. And like I said before, all of you, I love the medical field and the doctors. They have done wonders for lots of people, saved lots of people's lives. But you are not God.
Right.
And you need to get that complex out of your head because clearly you don't know what's going on. You know how to save people's lives, and that's great. You don't know how to run people's lives. So knock it off.
On another note, that $700 million that Walmart is putting in their bonuses for their associates equates to approximately $318.18 per employee.
Extra.
Mm-hmm.
Yeah.
Yep.
Yeah.
Not a bad bonus.
It's not bad, especially if you're one of the lower end employees, and Walmart actually pays decently.
Mm-hmm. I assume that'd be prorated through the different tiers of their employees.
Yes.
Yeah. Yeah. Not a bad. It's actually more than I was expecting out of them.
And to Walmart's credit, so Walmart received. This is why relying on the government to bail you out is retarded. Walmart received $1.4 billion from the stimulus thing. They didn't know why they received it, and so they sent it back. And they wrote a letter saying, however it is that you got this into our system, you need to take it out of our system right now and remove us from any future lists of receiving this stuff because we're fine. And the reason why they're fine is because they know that the government is going to allow them to stay open.
Now I'm torn because there's so many things that Walmart does that I'm just not okay with. But I could support that.
But the reason why they did not take it is because they were allowed to stay open. And they were the only ones you could buy from. This is something that also agonizes me. Capitalism's failing us. My favorite this is gone. This is gone. Capitalism has failed. No, this is what socialism looks like. This is absolutely what Marxism is. Mm-hmm. Marx says socialism, Marx, communism, all of it is the government saying you are essential. You have to stay working.
I'm essential.
You are not essential. You need to find a way to be essential or stay home. Or no longer be a member of society. It's usually the third one. And then, so that's what socialism is. Capitalism, a free market capitalism says, yeah, Walmart's great. They offer lower prices and all this stuff, but you can get better quality stuff here. It may be a little more expensive, but it's better quality here. Or there's this place over here that's cheaper that gives you the exact same stuff, but cheaper. Mm-hmm. That's free market capitalism. And you get to choose which of those you participate in. Or you can just start your own if you don't like either of those options. That's free market capitalism. Socialism says you can only shop at Walmart, you can only shop at Target, you can only shop at these because they can handle cleaning everything.
And then you have the spectrum in between, which we're about here at the moment.
Yeah.
Crony capitalism and crony corporatism are awful. And that's the point where you get, which is about where we're at, which is long past where we're at, where you have the large conglomerates and big companies like Facebook, Alphabet, which is the owner of Google, and these different big companies that then back different things in government legislation, such as net neutrality. Why do Google and Comcast and these other companies like that back net neutrality?
Along with Netflix.
It isn't because they actually care about you and your ability to use the internet. The reason they back it is because this legislation is detrimental to small business and it will squash all of the competition that can't afford to jump through the loops of the legislation, while they, being bigger and already established, can do whatever the hell they want.
Yeah, that $700 million bonus that Walmart's giving is basically their end profits extra on top of paying for whatever they had to meet COVID restrictions in the various areas. And they had $700 million extra. So they're like, well, let's just give it to our employees that have been working the whole time, that have constantly had a job.
And it's also a tax write-off.
And that. So they
Considered
taxes.
Bonuses are considered gifts from corporations and businesses like that. So whenever you get a bonus, your company you work for writes it off.
But you get to pay extra.
Lovely.
Riddle
right?
me that. The government always gets its money.
So on one end or the other.
So yeah, so that is what's going on. It's all about control. It's all about
You're just a conspiracy person. You just need to.
no. This is all the evidence, and it's not all the evidence. Actually, this is
a small skimming of all of the evidence.
this is a little tiny little crumble of.
This is
ice.
what we could fit into 3 hours.
This yeah, and so one thing I want to point out too is Mike and we don't have to do this. I don't have to stay up till 2 a.m. for 3 nights in a row finding all this stuff. I'm not getting paid to do this. I'm doing it because I think it's important, because I believe that there is amazing good stuff in the United States and the world, but I also believe there is also amazing evil in the world. And with all of this stuff, we have to do something. You have to do something to stop what you hate. Right now, I feel like this is what I can do to help that, even if it just reaches 10 people. So hopefully something we share here reaches you in a way that you reach out to your politicians or whatever it is, or start your own podcast to share your opinions on all this so more people are aware of things. Whatever it is, we don't have to do this. There's no reason. We have no incentive right now to do this. We are nowhere close to being paid. We have $0. And we've been doing this for 6 months?
At least.
Since April, I think.
April.
So 7 months. Something like that. Anyway.
Yeah.
And
almost 8 months.
Yeah. And
It'll be 8 months this month.
If you really are enjoying what we do here, if you really appreciate the things we do, Mike and I would love to do this full time. I hate answering to an employer because I love my employer. My
employer is awesome. He's my brother. So
yeah, I love where I work now. They take dang good care of me and my family. Their insurance coverage, everything is amazing, and I've got a really good future ahead of me with this company. That being said, I'd rather not. Because I am dependent on how well that company does, and I have almost no control over how that performance goes. So this kind of stuff, yes, I get aggravated. Yes, it pisses me off. Yes, all of these negative things. But I love it. I love finding this. I love learning. I love researching. I love finding ways to connect all these dots to show this is my opinion. Here's my things to back this opinion. Here's what it looks like here. Here's what it looks like here. Here's what I think. So that's the whole point of why we do this podcast is, yes, we have bias. Yes, we have our biased opinions. But at the same time, we're trying to show this is what's happening. I pulled up CNN articles, MSNBC articles, Washington Post, Washington
Examiner, New York Post.
Yeah. I'm pulling from everywhere to try to find the truth. That's the whole reason why we do this, because we believe the truth is worth fighting for, even if it's just a podcast that reaches 5 to 10 people every week. And it's really fun for me to go and look at the analytics for our podcast and see that we've got a download in the Philippines. We've got a download in Ireland. We've got a download in England. Whether or not you're actually listening to the whole thing, I don't know. But
thank you anyway.
Thank you anyway, because it counts. It counts for something.
I
It
agree.
Makes us feel good.
I agree wholeheartedly with everything you said, Trevor. And I would add, I do this not because I think that at any point I could be this great influencer with, thousands of people following us, anything like that. But I don't feel like I have to be.
Right.
I do this because I believe in it. And I believe that even if we don't hit that, maybe we influence somebody who does.
Right.
And that's just as important. Being the voice that gets somebody else to go and look and make a movement that succeeds is just as important as being the movement that succeeds, because it has to start somewhere.
Yeah. Yeah.
And I believe in all the things that we talk about. I believe in freedom. I believe in being good to each other. And in believing that people, if left to their own devices, will inherently come together and create working societies. Because that's what I see in the world.
Right.
And it's always good when it starts, and it always becomes corrupt the more people take power. And at points that when it gets to that point, the people need to fight back. And that's where we're at, and that's why I believe in the message that we share. And I've always said, in every situation, there's always 3 points of view. There's my point of view, there's your point of view, and there's the truth. And the truth never changes.
No. Yep. And with that, Mike and I, it is more important to be principled than it is to be right. Does that make sense?
Yes. I agree.
So, for example, this election stuff. I don't want there to be fraud. Because that's just bad. It's bad.
It's bad for everybody.
Especially if it's as widespread as it's being.
If it's as big as it looks like it is from the things that we've seen, that's not just something that we want to fight so that Trump can win. That is something that is cancerous to our beliefs. It's cancerous to everything that we love.
Yep.
And we don't want that.
Yeah. But that being said, I hope they find it and burn to the ground anything involved with it, anything and anyone involved with it, because that does not belong in the United States. My backdrop is different from when we started this, but the Constitution and Declaration of Independence, those are the principles.
They're all there. They're just not hanging because we
they're
don't have enough room to hang them in this room. We will in the next studio that we have, and the one after that's going to be even bigger, so we'll be able to do a little bit more there. We're slowly building and working up on a few things that we'll get. But
those are what's important. And those, to me, also include my principles with God and my religion and things like that. I'm not going to preach to you, don't worry. But it is more important to be principled, to be constitutional, because the Constitution doesn't care if you're the governor of the largest state in the United States or the mayor of the smallest town in the United States. The Constitution says these are things that government cannot do because a higher power gives you those rights, whether it's God, whether it's nature, whatever. A higher power than government is what allows us to have these rights. The government doesn't get to say what you can and cannot do on a day-to-day basis. You decide what you can and cannot do on a day-to-day basis, so long as it doesn't interfere negatively with somebody else. That's the laws of nature. And that's what the Constitution is. And if you really love what we're doing, share it. If you really believe the things we say, if you really enjoy the data that we hunt down and find, if you really enjoy the stories that we find and the links that we share, we try really hard to make sure we have links to everything we say so you can check what we're saying and follow whatever breadcrumb trail is within those links. Because we want to be honest and open. We think this, we see this, that's probably what it is. If it turns out later that's not the case, that's not the case, and we'll try to...
And we'll post that source with the new opinion.
For example,
on it.
Our when we did the Black Lives Matter stuff, Black Lives Matter changed their website after we reported on all that. So I went to the Wayback Machine, pulled the website address from the Wayback Machine that captured what we were talking about, changed the link in the thing, and made a note that it was changed. You can go back to that episode and you will see that the link includes the Wayback Machine and a note of why it is that way. We try to be consistent and honest and open. And again, if you really love what we're doing, you can support us by liking our stuff, sharing our stuff, downloading our podcast. Even if you don't listen to them, you can download it, delete it. It counts.
It does. It helps the analytics.
And then on top of that, if you really, really, really like it and you feel like you have the charity to do so, we're trying to do things on Patreon where you can directly fund us, and getting things going that way will allow us to be more enthused and driven towards finding things like this.
And eventually it'll let us do bigger and better things.
Yeah, and do more than one episode.
It'll let us do more than one episode a week. It'll let us do more of the cuts of things like we did tonight. It'll allow us to do some things where we can bring somebody else on and have them help us do videos and skits and different things like that we can put out, because we'd love to do stuff like that.
That 5-minute video supercut, that 5-minute cut that I did, it took me half a day to do that. It took me like 6 hours to put that together. So that's finding the videos, that's putting it together, that's listening back through the videos over and over and over again to make sure I pull the right snips to put at the end for the supercut, finding the dates for everything and when they happened and all. It takes a lot of time, but like I said, I care about this stuff because it impacts me. And I hate hypocrites.
Yep.
Anyway.
Feel that in my bones. Well, we're at 2 hours.
We're at 2 hours. Do you want to save these for next week, or you want to just meh them?
Well, I found a bunch more.
Next week?
I don't know if next week we're gonna have other things to cover.
That's true.
I mean, it's not doing them justice, but we can just burn through them real fast.
And we'll put the links in so you can.
And we'll put the links in. So, I mean, to give us a lighter note, to go in before I make myself mad with the last couple of them. So the UN Health Agency's advice for the holidays is to avoid hugging.
Piss off.
So the World Health Organization has come out as of yesterday. Dr. Michael Ryan, who is the WHO's emergencies chief, said Monday, the epidemic in the U.S. is punishing. It's widespread. It's quite frankly shocking to see 1 to 2 persons a minute die in the U.S. His count is a little off. Just a little off.
The WHO is wrong?
The WHO is wrong. Yes. He says 1 to 2 persons per minute. So I went back from April to today, and you're closer to about 0.6 people per minute.
So just barely off.
Just barely off. So, and a country with a wonderful, strong health system and amazing technological capacities. And that's if the actual death count is correct, which I'm not sure it is, because influenza deaths are down, heart deaths are down, pneumonia deaths are down, all these other deaths that are usually...
All the comorbidities.
All the comorbidities are down. So there's that. But anyway, so that's his advice for the holidays is don't hug anyone, because hugging leads to cooties and COVID.
My response, piss off.
I agree wholeheartedly. And then in other news, America's highest paid hooker sues Nevada to reopen brothels. Enough said. So...
She's gonna win.
She's gonna win. I mean, she's America's highest paid hooker, so how could she not win?
She's gonna win.
In that case, in Nevada.
No, we can't lose our biggest industry.
That was one of those I read it and I was like, oh, it's the Babylon bee. No, that
is not the bee.
That is not the bee that just said that out loud with their inside voice on the outside. And in other news, I think it was last night or maybe this morning, some point today, Senators Grassley and Lehigh passed the bipartisan whistleblower protection legislation in the House, which, for those of you that don't know what this is, it is a criminal antitrust and anti-retaliation act that is supposedly supposed to shield private sector employees from reprisal when they try to shine a light on activities that violate our antitrust laws. So not quite covering Snowden and some of the other Julian Assange and those because they were blowing the whistle on the government, not on companies.
So it's good, but it's not.
It's good, but it's not great.
Yeah, good, better, best.
Maybe good. I don't know. I haven't actually dug into the meat of this one. I just saw that it passed today.
On the surface, it seems to be doing good.
It seems to be good, but we all know what happens with the surface of.
You have to pass the bill to know what's in it.
Pass the bill to know what's in it. So then we've alluded a couple of times to this other segment I'm going to talk about real quick. So for those of you that didn't hear, Trump tweeted a video this week of a professor in China who posted on social media one of his it looks like a part of one of his speeches from one of his classes.
Right.
The professor is D. How do you pronounce that? D. Dongsheng. I think D. Dongsheng from China.
Yeah.
Who essentially said that China has people in power in the U.S. that have been helping them.
Yeah.
For a while now, like since the 70s. So, and Tucker,
he said the relationship was true for decades until President Trump came along.
And Obama administration was easy to manipulate.
And he's excited to work with Biden in the White House.
Mm-hmm. So excerpts from the video were tweeted by President Trump on Monday, and then Tucker C. shared a clip on his show. So this is kind of blown up all over the place. People talking about this, about that, especially because it comes right on top of a couple of, and this is like a series of things that have happened over the last several years of Chinese spies and Chinese influence being found in the upper echelon in the U.S.
Sorry, I love this picture. Donald Trump is not happy to be there, and what's his name, Xi Jinping?
Yes.
Is not happy to be there.
Neither one of them. Neither one of them.
Trump is just there shaking his hand because he's trying to be a president. He's trying so hard to just be president and go home. And then you get down here. You have Biden and Xi Jinping fostering goodwill between America and China. It's like the tattoos. Everyone gets in America, they get the Asian tattoos and think it's cool. And then you go to Asia and they get the America lettering tattoos and think it's cool, but it's not. Joe Biden's just happy as can be, and Xi Jinping is contempt.
Yep.
So I have you in my pocket. That's fine.
That sounds about right. And so like this all comes kind of at the end of a trail of I guess a couple of different things where people were suspected of different things. What did you find there?
The video was deleted from
yeah.
Chinese social media soon after being uploaded, but copies were made, which have since been circulating, including YouTube.
Yes.
110% the Chinese government found out who made copies, and they don't exist anymore.
Probably. And the really interesting thing about this is like he says right in the middle of the video, and we'll post the link so you can go watch the whole thing. I'm not going to play it because it's all in Chinese,
and you don't want to hear us read
you don't want to hear us read subtitles from this guy talking. So you can go watch the video, read his subtitles, scroll through the pictures, see all this different stuff, and it's kind of important too because you need the context of the different things that he's saying here, because he does mention those things. He actually, at one point in his speech, if you watch the entire speech, it's about 19 minutes long, 18 and a half, somewhere in there. And he talks about someone from Wall Street working in Beijing for the last 30 years and the influence that they had and all this different stuff. And at one point he's talking and he's like, I can't give any more details because it would be...
It'd be... politically incorrect.
It'd be politically incorrect, which means something entirely different in China than it does here, just so you know.
Yeah. That means I don't want to die.
There's a Uyghur camp that has an opening that is about me shaped if I say anything more. So there's that. And all of this comes right in line with, like I said before, several allegations of different kind of weird things with Chinese spies and Chinese influence. There was one a year or two ago with a lady that was arrested. I believe she's still being held. I know I haven't heard about her for a while. I can't even remember her name off the top of my head, but she was pictured with a bunch of Republicans. And so that blew up and made headlines a little while back.
Fang Fang?
No.
Oh.
Nope. This one, Fang Fang is on the Democrat side. So I just used that one first to point out that it is both sides here.
They are trying to manipulate both sides.
It does not matter Republican or Democrat. It is more about the establishment. Establishment politicians are being targeted. They are being bribed. They are being supported by the CCP, and more of these stories are coming out. And this one is really interesting because it reads like the headline of like a comic book chapter. So the headline is How Fang Fang, the Chinese spy, slept with 2 U.S. mayors and targeted politicians, including one of the youngest members of the House, before slipping out of the U.S. when the FBI came knocking. Now, if that isn't like a Black Widow style comic book episode, I don't know what is. So the highlights of this one, I actually really like the way that the Daily Mail does this because they kind of give you the too long didn't read right at the top. It's beautiful.
I have time to read the headline and maybe a little bit more.
And then if I really want to delve into it because it caught my interest, I can keep going.
This is a modern day newspaper. So right here it'd be continued on page B7. Well, I guess I'll never know.
Right. Exactly. So it's actually really awesome because it really highlights everything that they kind of put into it. They even have the names of people who were compromised by Fang Fang while she was here.
Fang Fang.
So it starts out like her so she goes by Fang Fang or Christine Fang. She's reportedly a Chinese intelligence operative with China's Ministry of State Security. Oof. So she is Chinese government.
Chinese CIA, basically.
Essentially, yeah. So she was in the California Bay Area from 2011 to 2015 and reportedly used campaign fundraising, networking, her charm, and romantic relationships to get close with politicians. That doesn't sound like anything that politicians do at all. I mean, I did not have sexual relations with that woman.
She is the Chinese Black Widow.
She really is. So and the next couple lines actually call out Democratic representatives that she influenced. So she helped Representative Eric Swalwell fundraise his re-election campaign.
Oh.
And had interacted with him at several events.
Oh.
She also helped Tulsi Gabbard fundraise and became well known by California's political scene.
Oh.
So she's interacted, and several of the articles I've read on this, there's tons of them. You can look at Axios, you can look at the Daily Mail. There's a bunch of different ones that you can look at. Now, Eric Swalwell, I know at least, as soon as he heard about what was going on, he distanced himself, pulled himself back from any
hey, this
involvement with
Fang
her.
lady is actually a Chinese spy. Oh, is she? She
oh,
is.
is she? She is. I'm
just
gonna
go
have
ahead
to
and delete that, and that is done, and that is no more.
I'm never speaking to this woman again.
Sure.
And so there's a few different articles you can read on this that talk about her involvement with different representatives in California. One of these pictures has her pictured with Representative Mike Honda, who was a San Jose City Council member.
And then, yeah. Okay, no, you're good.
Oh wait, no. So he Representative Mike Honda and a San Jose City Council member by the name of Ash Kalra. And like literally you go through here and it's congresswoman, representative, all these different like
they spelled PPAP wrong.
PPAP appa
Pen pineapple apple pen.
Judy Chu, they have all of this stuff logged of her interactions with different representatives, different congresswomen, different board members, different council members, different city representatives. And
who's that guy?
He's blurred.
The blur.
I don't know. Let's see. Left to right is Fremont City Council member Raj Salwan, Ro Khanna, and Fang. They don't actually list who the person in the middle that's blurred out is.
I wonder if that's blurred on her. That's her picture, and she blurred it. I wonder. I don't know.
Maybe.
Weird.
I don't know. But
and then there's
there's more of the tweets of
that should be a meme. I don't know why it's not a meme, but
let's make it a meme.
Trump's disgruntled face.
We shall make it a meme. We shall meme it,
and we will meme it.
And this is just on top of so many other things coming out right now that basically just suggest that China has more or less already instigated a political war with the U.S. They've placed people in high places. They have this video talking about the circle of power in the U.S. that has been aiding them through the years, that has been severely disrupted by the Trump administration.
Yeah, there's been professors and students that have been and professors and university students that have been detained by the FBI because they were transmitting and selling information from the university to China. And even my work, my old work where I used to work, Micron, they've had to deal with people stealing their technology they're developing and selling it to Chinese companies.
Mm-hmm. And this is, I don't know how many people have looked at the generations of war at all, but these
are the generations of war.
This is textbook 5th generation war. 5th generation warfare. And so, I mean, you just do a quick Google on generations of warfare, and it lists, all the different ones. You have the latest one, fourth generation, which is the postmodern decentralized form of warfare, which is basically it's a beginning to blur the lines between war and politics, where you have both the political warfare, which is going in and disrupting governments and things like that, as well as combatants on the ground, Air Force, Navy, those different kinds of things. Fifth generation warfare is this kind of next step idea of warfare, which is essentially utilizing social media. It's utilizing political ties and all of these things to go in and essentially make another country implode without your fingerprints on it.
It's almost as if
without ever declaring war.
It's almost as if someone once said that the United States will not be destroyed from external forces, but it will destroy itself from the inside.
Right. They call it non-contact warfare.
Right.
So you never fire a shot. You never actually invade anybody. You never do any of that stuff. You just put pieces in place and let them do the work for you.
Benghazi.
And that is why the stuff like Swalwell and Gabbard and all this, and Tulsi, I've seen interviews with her. I don't really think that she would be on board with something if she knew, China was trying to manipulate her, stuff like that. I don't think that these people really have an agenda where they're specifically working for the Chinese government. But that's the scary thing about this idea of fifth generation warfare, is that they don't really have to.
Right.
You don't start a news company that's going to spin the news the way you want and then hire people that you have to tell them how to report news or what they can and can't tell people, right?
Yeah.
You hire somebody that already believes in the cause. You hire somebody that already is going to do those things themselves, and you just turn them loose. And that's essentially what China is doing, is they're finding the weak points in our government and in the corporations in our country, these different things. They're finding, the CEOs of Alphabet, I'm sure, have been approached this way. The CEOs of Facebook, of Twitter, of all of the major social media, all of the major corporations, all of our high-powered politicians and high-placed representatives, all of these people, they may not have somebody whispering in their ear that you should push this agenda, but they are most definitely receiving someone has been placed in their lives, in their campaigns, in their general vicinity, that is supporting and funding and helping them
get to a position
where they can do it, because they already have those ideals. They already believe in gun control. They already believe in abortion. They already believe in, pick your policy that is supported by the CCP, which both of those things are very much supported by the CCP and practiced on a daily basis. And I mean, you talk about we'd never have a concentration camp in America. Well, look around you. What have they been calling for the last 2 months since the election began? As soon as Trump is out of office, we're going to need to open re-education camps. People have said that in America.
Yeah.
And you don't need to get somebody in power to push that agenda. You need to find somebody that wants to push that agenda and find a way to put them in power.
Yeah.
That's the easiest way to do it. And then you can back off and not have anything to do with it.
It's not about manipulating their minds. It's about manipulating the system to get the people you want there.
Exactly. And it's so easy to manipulate the system. People don't understand, when we talk about stealing the election and things like that. I'm not just talking about somebody going in and scanning a ballot 3 times, or finding the box under the table and counting it when nobody's there, or lying about a water leak, or any of those things. Those things are things that we talk about because they're in the news right now and they're in lawsuits.
And it's fair, and it's something that you can see.
Something that you can see. What you don't see, what you can't quantify really, is the effect that Google searches, for instance, have on an election, the effect that Facebook has on an election, the fact that they block anything that goes against their ideal of the election.
Or they put a little tag on it.
Or they put a little tag on it. Yeah. And the polls, the effect that polls have on the election. The thing that blows my mind about the election this year is Biden broke every metric if he actually won. Literally every one of them.
Not impossible, but extremely
Not impossible, but
improbable.
extremely improbable. And when I talk about metrics, I'm meaning like the bellwether metrics. Like the certain states. If you win certain states, you almost always win. And
like winning
he
17% of the
lost
counties.
every single metric. Not just like a handful or the majority of them.
All.
Every single one,
including the cookie metric that's very recent.
Yeah. So and yeah, you can say those are weird, whatever. But I'm not just talking about the weird ones like the cookie metric. I'm talking about certain counties that whoever wins them usually wins the election. Certain states, whoever wins them usually wins the election. These things that it's never happened before.
If Joe Biden is confirmed to be the next president of the United States, he will have won an election with the fewest counties in his support in U.S. history. 17% of United States counties voted in favor of Joe Biden.
In order to do that, Biden would literally have to be the most popular president in American history.
And all metrics leading up to the election show that he was not all that popular.
No. More people voted against Trump than voted for Biden.
Yep.
And say what you want about Trump, he was not that hated.
Yeah.
Absolutely no way.
Yeah.
He was that hated. And so when you see those things, it's all red flags. Any one of these things individually means nothing. All of these things together is concerning. It's red flag after red flag after red flag after
I'm
red
not
flag.
saying there's a fire, but all of the alarms are tripped.
Every alarm is tripped. There's smoke billowing out of the windows. Texas is suing Michigan. And
China
Grandma fell down the stairs. I don't know what's coming next. Like, really, though, this is ridiculous. And it's just such... It's so heartbreaking to see, like I was saying earlier, these people that can see, you've been here this whole year. You've followed the news. You've followed all these different things. At least I would hope you have, because you should be informed.
You've been commenting about it. You should remember it.
Yeah, exactly. And you can see the degree of change. You can watch it. It's quantifiable.
Get past the headlines.
And don't get the tunnel vision. Don't look at just what they're saying today.
Right.
Look at what they've said over the whole course. They have changed course repeatedly and consistently throughout the year. And they've never backtracked what they've said before. They've denied.
The science keeps changing. Is that because you believe that, or because that's what they said?
Right? and I'm not saying you shouldn't listen. You should listen. You should listen to everybody. And then you should make up your own mind.
Question with boldness. Fix reason firmly in her seat, and question with boldness. Everyone is entitled to their opinion. Everyone is entitled to sharing whatever facts they want to share. Bill Nye the Science Guy is just as qualified to talk about the coronavirus as you are.
Mm-hmm.
His stupid little video has been floating around, and you can debunk his video by just looking at the stats that we showed you today. Because he is not a scientist, even though he's the science guy. He's an engineer. That's his. He's got a degree in electrical engineering or something, some sort of engineering degree. I don't know. I don't care. He's a douche.
Right.
But people like that, and honestly, people like Fauci, you are just as qualified to make an opinion about how life should run as he is, because you have access to the same data he does, and we showed you all of that data, and he has gone back and forth on it the entire year, starting around April when it was popular to blame Trump for everything that was wrong.
And you know, the whole point just boils down to do your own research. Listen to us, listen to other people. Listen and read.
Trust but verify.
Exactly. And find the thing in your heart that feels right.
Mm-hmm.
Because, like I said before, there's 3 sides to every story. My side, your side, and the truth. My side and your side are not the truth. They might have pieces of the truth, but honestly, none of us has a perfect vision of what happened. None of us was there for every single event that occurred. And so we can't know exactly what the truth is. Somebody out there knows what the truth is. Somebody knows what the truth of each one of these things is, but nobody knows what the truth of all of these things is.
This is why courts almost always require more than one witness.
Exactly. And so, you know, the best you can do is look at everything that you possibly can and then make your own decision. Because listening to somebody else and taking their opinion as what you should believe is a cop-out.
Mm-hmm.
And it doesn't fly. It's not going to work for long, because that's how you end up with 5 years down the road, and you look back and go, oh, whoops. I guess there were commies in the U.S. messing with elections.
Done messed that up.
And now I'm standing in a bread line and I don't know why.
Exactly.
You know, it's the I'm mad that you're closing us down, but you should give me money because you're closing us down.
I'm mad that you're closing me down and I'm not getting paid. So, but if you can pay me while I'm closed down,
then I'll be fine.
I'll be fine.
And you have to take a hard look at the ideal that you're investigating and actually investigate it. Take it apart. Look at not just what it does for you right now. Look at what it will do for you in the long run. And in the long run, bar none, the option to be self-sufficient and be self-motivated and be self-sustained will always benefit you more than the short-term option of somebody help me.
Mm-hmm. Teach a man to fish or give him a fish. And in society, there are 3 types of people. There are sheep, there are wolves, and there are sheepdogs. Which one are you going to be?
Yeah, so, well, that was my soapbox for the night.
Yeah.
Mine was considerably shorter than yours. I kept mine to about half an hour. You're welcome.
Yeah, well, yours is at the end where everyone's going to stop listening, so.
Too long, didn't listen.
TLDL.
Yeah, because this episode is 3 hours long. Holy Nikes.
Yeah.
All right, well, I guess that means that we should sign off for the night,
I
yeah?
guess so, yep.
All right. Sorry for the super long episodes, but you're welcome for the super long episodes. So like, comment, subscribe.
You're still here at the end.
Share.
Let us know that you listened all the way through this. Seriously, because I want to know if you actually care.
Yep, I do too. So leave a comment. Something simple like 5 stars and a TLDL would be great.
TLDL. Even better, link TLDL in your
Link
comment.
TLDL in your comment. Hashtag TLDL.
Too long.
Didn't listen.
It's one of our shortest episodes.
All right.
Thanks, everyone.
Thanks, guys. Love y'all, and we'll catch you next week.
Bye. There you go.
You gotta hit yours.
Yeah, I had to hit mine. I always hit mine after yours.
Is it good now?
It's easier to sync that way.
Can I go now?
You can go now.
Okay.
Go.
You sure?
Go.
Okay.
Yeah.